Chairman, we're ready to begin.
Okay, thank you, Denisha. Would you please do a roll call of the board members, please?
Yes. I'll begin with Norman Boyd,
Here.
Russell Crutchfield,
Here.
Cynthia Rucker,
Here.
Roger Cole,
Here.
David Cruz,
Here.
Anthony Williamson,
Here.
Melva Lee,
Here.
Shane Mobley,
Here.
thank you. Dr. Coles, Robert Coles, your mic may be muted, but I do see that you are joined in the meeting.
Okay. Thank you, Denisha. I believe that concludes the roll call, and we appreciate all the board members joining this morning. And we have several items. We do have a quorum, so we can conduct business. So I'll call the meeting to order. In our agenda this morning, we're going to be reviewing 5 different items that are on the agenda, and we will be asked as a board to vote on those for final approval. They have previously been initially adopted and have gone out for public comment, and we'll hear the feedback on that. And I think each of the board members have been given copies of any feedback or public comments on those items so that we could review them prior to the meeting. So with that, we'll move into the agenda. And the first item on the agenda is previous minutes of meetings. I'm going to, the agenda says that our new secretary, Dr. Rucker, is our new secretary, but I know that in each of the meetings that we're going to be reviewing the minutes for approval, we're under Russell Crutchfield was the secretary at that time. And so I think we should probably vote on each of those minutes separately. So the August 25 meeting minutes, Russell, have you had a chance to review those, and would you recommend those for approval?
Well, good morning, Mr. Chairman. Yes, I have had the opportunity to read over the August 25th board meeting minutes. I have found them to be in order and correct, and I move that we approve the August 25th board meeting minutes.
Thank you. Is there a second to that?
Dr. Lee, I second.
It has been seconded. All in favor, say aye.
Aye.
Aye. Aye.
Opposed? Abstaining? Hearing none, they are approved. Russell, have you had a chance to look at the September 8th, to review the September 8th minutes, and can you recommend those for approval?
Yes, I have had the opportunity to read over the September 8th board meeting minutes. They are correct and in order, and I recommend that I move that we approve the September 8th board meeting minutes.
Is there a second to that?
Second, Cynthia Rucker.
Dr. Rucker has seconded that. All in favor, say aye.
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 Opposed? Opposed? Abstaining? Hearing none, they are approved. Thank you very much, Russell, for reviewing those minutes for us. Next, I will turn it over to Commissioner Nagel for her report.
Good morning, and thank you, Mr. Chairman and members of the board, for being with us today. Too many significant updates to share with you today. I think we're about to, as we turn the corner into fall, we're also turning the corner into really a couple of the items today, wrapping up some of the last of our board actions from last year's budget. Still have outstanding items pending with CMS, but we've really almost wrapped up the work initially to get those up there on most of the things that were passed during the last legislative session. So it's only timely that we now are starting to turn our attention, as we did last month, to our budget request for the upcoming year, as well as we're beginning to have some very preliminary conversations about any potential legislation that the department will want to pursue for next year. And we'll keep you posted if any of those conversations produce any actual policy or legislative changes on our future radar. We do have a number of things that are less, more in the terms of studies that we're working on as directed by the budget. We have a number of rate studies that were required of us that we're working with on our actuarial firm to complete, still on track to complete, hopefully by sometime in December, that we'll certainly share with the board and members of the public as soon as those are completed. I do think I heard that we received just this morning CMS approval on one of our state plan amendments related to the dental rate increase that was included in the budget. So we'll make sure that that's finalized and then share some information publicly on the rollout and processing of that as well. Our CMO procurement continues to move forward as we continue to do some internal analysis and start to think about an RFP design. Currently still on track for release of that RFP sometime this winter. We've talked about the pathways or 1115 waiver that had a very favorable court decision, and we are invigorating our timelines and project plans to move that 1115, the limited Medicaid expansion under Governor Kemp's leadership, forward here pretty soon, and have started to re-engage our project team, and we'll be scheduling conversations and meetings with our partner agencies to make sure that we all get back on a timeline to move that forward that works for everyone. And then I think probably one of the biggest things we're keeping our eye on this week is, again, the federal public health emergency. It is slated to end on the 15th. Today is the 13th. We would expect probably to see some notice today or tomorrow from CMS on that extension. We're still operating under the assumption that they'll stay true to their word and give states 60 days notice. So I am hopeful that we see some extension. I think our plan, the budget that you've seen, assumed that it would go into December. And so we'll be sure to report back next month on the status of that, but I expect to see something in the next few days. And the absence of that, we would then can assume that it ends and continue on with our plans with our sister agency and DHS and DFACS in terms of redetermination of Medicaid eligibility for all the members. You will start to see in the next few weeks a bigger presence in the media of the communication around the pending redetermination for members, both encouraging them to update their contact information, but just to watch their inboxes and mailboxes for updates and communications about requirements on their end to provide additional information so that that can be done both timely and correctly. And then I'll just end, Mr. Chairman, with recognition of our staff milestones for this month. As I always like to do, Ashley Morrison, Raymond Simon, Shinyar Arush, and Anna Jackson are celebrating 5 years. Catrice Soto is celebrating a 10-year anniversary with the department. Adrian DeBar and Bobby Burton are both celebrating 15 years. Bonicia Stelly is celebrating 20 years. Rachel Gilstrap is celebrating a 25-year work anniversary, and Joyce Wilson in IT is celebrating a 35-year milestone with the department and the state. So as I always say, we couldn't do what we do without our staff, and I'm very appreciative for those folks and the milestones that they've reached. So thank you, and that concludes my report, Mr. Chairman.
Thank you, Commissioner. Are there any questions or comments for the Commissioner from the board, please? Hearing none, thank you for that update. We'll move into the items that we are going to be asked to consider today for final adoption, and ask Kim Morris, our Director of Reimbursement, for the final adoption presentation related to disproportionate share hospital methodology. Kim, you may begin.
Good morning, Chairman Board, members of the board, and Commissioner Nago. Today, I'm presenting for final adoption pending Medicare and Medicaid service acceptance, a proposal to change the disproportionate share allocation methodology to increase the allocation basis for hospitals receiving directed payment through the directed payment programs by the amount of any intergovernmental or certified public expenditure received on behalf of the hospital, effective for dish payment adjustments made on or after October 1st, 2022. There are no additional federal or state funds needed for this change. The change in methodology is to assure hospitals participating in the state's directed payment program do not receive a reduction in their dish allocation. Last month at last month's board meeting, it was noted that this proposal was first presented and adopted at the May 13, 2021 board meeting. The State Plan Amendment 21-0014 was submitted to CMS in June of 2021. While the department continues to have discussions with CMS and believe the original State Plan Amendment will be approved, we've issued a public notice specific to the change in the DISH methodology to ensure we can implement the proposed change for the state fiscal year 23 DISH allocation calculations. At this time, I will pause to see if there's any questions from the board.
Any questions, comments from the board, please? As I understand here, Kim, in your summation here, there's no additional funds required here, and there were no, in the public comments, there were no comments either oral or written. Is that correct?
Yes, I'm sorry, and I'm sorry, I skipped right over that part. I do apologize for that.
That's okay. Thank you very much. If there are no comments from the board, is there approval or is there a motion for approval for final adoption, please?
Motion for approval, David Cruz.
David Cruz made the motion for approval. Is there a second?
I second, Dr. Lee.
Dr. Lee has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Kim, thank you very much.
Thank you.
Next, we'll call on Carisha Lang, Interim Executive Director, the Office of Health Planning. And she will present rules and regulations for health planning in the certificate related to certificate of need. And this is also be considered for final adoption. You may proceed.
Thank you. Good morning, Chairman. Good morning, Commissioner Noggle, as well as the members of the board. The Office of Health Planning presents rules today for final adoption. These rules are found in Chapter 111-2-2 of the Department's Rules and Regulations. A draft copy was provided to you. The proposed rule changes reflect amendments to Rule 111-2-2-.071 G1 and 2, review procedures for the Certificate of Need program. The proposed changes make updates to the criteria that must be met for a party to oppose an application for a Certificate of Need for a proposed project. Specifically, the proposed changes require either that in order to oppose an application for a Certificate of Need, an opposing party must offer substantially similar services as proposed in Georgia and within a 35-mile radius of the proposed project, or have a service area in Georgia that overlaps the applicant's proposed service area. Or that opposing party must have submitted a competing application in the same batching cycle and proposed to establish in Georgia the same type of facility proposed, or offer in Georgia substantially similar services as proposed and have a service area located in Georgia that overlaps the applicant's proposed service area. Additional revisions are proposed to correct grammar, provide clarity, and modernize the rules. A public comment hearing was held on September 7th, 2022. Written comments were due on or before September 9th, 2022. No oral comments were received. 129 written comments were received from various Georgia citizens. Written comments were also received from Carrie F. Conley, the General Counsel and Senior Vice President of Healthcare Policy with the Georgia Hospital Association. Also from Jonathan Connell, Chairman of the Northwest Georgia Hospital Coalition, Inc. As well from Earl Gray, Mayor of the City of Fort Oglethorpe. Also from Jeff Mullis, President and CEO of the Northwest Georgia Joint Development Authority, and from Monty Veazey, the President and CEO of the Georgia Alliance of Community Hospitals. The written comments can be summarized as follows. The 129 comments of substantially identical language from individual Georgia citizens expressed support for the proposed rule change. The commenters opined that out-of-state entities should not be allowed to interfere with medical access for Georgians. The commenters referenced the pending appeal by a Tennessee hospital of the grant of a certificate of need to CHI Memorial Hospital to construct a replacement facility in Northwest Georgia. The Georgia Hospital Association expressed full support for the proposed rule change and the department's effort to clarify which parties have standing to oppose or appeal a certificate of need application. The Georgia Hospital Association suggested that the proposed rule change is consistent with the intent of House Bill 186, which became effective on July 1st, 2019, and made significant updates to certificate of need laws. The Northwest Georgia Hospital Coalition, Inc. expressed support for the proposed rule change to ensure critical access to care for Georgians cannot be denied or delayed by entities in other states. The Northwest Georgia Hospital Coalition, Inc. referenced the pending appeal by a Tennessee hospital of the grant of a certificate of need to CHI Memorial Hospital to construct a replacement facility in Northwest Georgia. The city of Fort Oglethorpe expressed full support for the proposed rule change to address what it described as a gap in the current law and to ensure critical access to care for Georgians cannot be denied or delayed by entities in other states. The Northwest Georgia Joint Development Authority expressed support for the proposed rule change to address what it described as a loophole in the regulations and to ensure critical access to care for Georgians cannot be denied or delayed by entities in other states. The Northwest Georgia Joint Development Authority referenced the pending appeal by a Tennessee hospital of the grant of a certificate of need to CHI Memorial Hospital to construct a replacement facility in Northwest Georgia. And lastly, the Georgia Alliance of Community Hospitals expressed full support for the proposed rule change, which it described as being consistent with past practice and sound health planning principles. The Georgia Alliance of Community Hospitals indicated that out-of-state non-applicants have never been a party to Georgia's certificate of need regulatory process. Among other things, the Georgia Alliance of Community Hospitals indicated that out-of-state non-applicants are not regulated by Georgia's certificate of need or licensure / healthcare facility regulation laws or rules, do not complete surveys or report any operational or financial data to the department for health planning purposes, and do not make commitments to care for Georgia's indigent or charity care populations. According to the Georgia Alliance of Community Hospitals, the proposed rule is needed to confirm the department's position that an unregulated out-of-state provider is not a party granted standing under the Certificate of Need Act to oppose or appeal certificate of need decisions. The department thanks each of the commenters for the written comments and support. The department is requesting consideration of these rules for final adoption today. I'm happy to answer any questions regarding the proposed changes.
Thank you very much. Are there questions, comments from the board, please? As I understand and make sure that the board understands here that what you're presenting is that all of the written there were no oral comments, but all the written comments, which were quite extensive and were all in support of the rule change. There were no comments written or oral that were opposed. Is that correct?
That's correct.
Okay. Any other questions, comments from the board, please? Hearing none, is there a motion for approval for final adoption?
Roger Folsom, motion for approval.
Roger Folsom has made the motion for approval. Is there a second?
Cynthia Rucker, second.
Dr. Rucker has seconded that motion. All in favor say aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved. Thank you very much.
Thank you.
Next item that we're asked to consider for final adoption, the next three items will be presented by Joe Hood, our Chief Operating Officer. So Joe, you may proceed.
Thank you, Mr. Chairman. Good morning to you, the Commissioner and board members. Today, I bring to you a request for final adoption, a change in healthcare facility rules and regulations for birth centers that are referenced in Georgia Rules and Regulations 111-8-7. Specifically, the proposed rule changes reflect an amendment to rules cited in Georgia Regulation 111-8-7.22 by deleting a reference to Chapter 111-8-3, which presently does not exist in the rules. There was an opportunity for public comment on September 6, 2022 at 11:30 via Zoom, and written comments were accepted on this rule change through September 9th, 2022. There were no public comments received. If there are not any further questions by the board, I would ask for favorable adoption of this rule change.
Any questions, comments from the board, please, for Joe? Hearing none, is there a motion for approval for final adoption?
Russell,
This is Shane, I motion.
Shane Mobley has made the motion for final adoption. Is there a second?
Russell Crutchfield, second.
Russell Crutchfield has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Joe, you may proceed.
Thank you, Mr. Chairman. The second proposal is a request for final adoption for a change in healthcare facility regulation 111-8-4, which references ambulatory surgical treatment centers. Specifically, the proposed rules reflects an amendment to a rule cited in Georgia Rules and Regulation 111-8-24.24 by deleting a reference to Chapter 290-5-32, Rules of the Department of Human Services, that is obsolete because of the passage of House Bill 481 during the 2019 legislative session. There was an opportunity for public comment on the rule change on September 6, 2022 at 2 p.m. via Zoom, and written comments were received up to September 9th of 2022. However, there were no comments received in either forum. If there are no questions from the board, Mr. Chairman, I would ask favorable adoption of this final rule.
Any questions, comments from the board, please? Hearing none, is there a motion for approval for final adoption?
Roger Folsom, motion for approval.
Roger Folsom made the motion for approval. Is there a second?
Second, David Cruz.
David Cruz has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, you may proceed, Joe. Thank you. It is approved.
Thank you, Mr. Chairman. This last request is a final adoption of a change in healthcare facility regulations that are referenced in Georgia Rule and Regulation 290-5-32, Rules of the Department of Human Services, Chapter 290-5, Public Health. Specifically, the proposed rule changes reflect an amendment to rules cited in Georgia Rules and Regulations 290-5-32.01, 290-532.02, and 290-532.04 and 0.05 by repealing said rules made obsolete by the passage of House Bill 481 during the 2019 legislative session. There was an opportunity for public comment on September 7th of 2022 via Zoom at 11 a.m. And there was also the opportunity for written comments, which were received before September 9th of 2022. There were no comments received in either forum. If there are no questions by the board, Mr. Chairman, I would ask for favorable adoption of this final rule.
Any questions, comments from the board, please? Hearing none, is there a motion for approval for final adoption?
Russell Crutchfield, motion to approve.
Crutchfield has made the motion for approval. Is there a second?
Roger Folsom, second.
Roger Folsom has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Joe, thank you very much.
Thank you very much.
That concludes the items that we were asked to consider today for final adoption. I thank all of the board members for taking the time to be with us today and participate in the meeting, and thank the department for providing the information on the proposals in advance of the meeting so that we've had an opportunity to review those items for consideration today. Does anyone know of any new business that needs to come before the board at this time? Hearing none, I will adjourn the meeting, and our next meeting will be November 10th. So thank you again, and all of you have a good day.
Thank you.
Thank you.